Hey everybody.
Hello.
How you doing today?
I'm doing wonderful.
You doing great?
Yes.
Okay, I see you got
On
that
this special day.
special day.
Special God's day.
Okay, okay.
These days are always special.
Okay. Listen, y'all. Today we came on to talk to you all about everything medical. Right?
Everything?
Everything medical. Listen. We have had some situations that happen since we've been here probably in the last month and a half month, and it made us start thinking about what will we do like in case of an emergency, right?
Right, we did.
Yeah. And so we had to, we wanted to tell you all, or come on and just let you all know, like anytime that you're somewhere else, we're in Ghana, medical systems, everything is different here,
It's totally.
totally different.
Yeah.
And what had happened was, the first thing we're gonna talk about a couple of different things. The first thing we're gonna talk about pharmacies. So our daughter had sent. I'm sorry, our daughter was sending us Joseph's prescriptions, right? Sending him the meds because they were mailed to her. Tell him what happened.
Well, she went to the post office
Um,
and mail.
but what did you call that? Wait a minute. You called it something else. What did you say your medicine did?
Oh, I know that they first went on vacation
They went on vacation.
in France.
They went to Paris.
Yeah.
So yes, he had sent. She sent us the medicine. They told us it would be here. I told her they should be here. I know it's gonna be less than 15 days. I'm gonna say 10, 13 days that it should have been here, right?
Mm.
So when we hadn't heard anything about it, we actually first went to because she would check the tracking, but we went on to the post office here, and of course they couldn't find anything, and all the tracking was saying is that it had left the LA facility,
Yeah.
but it wasn't saying where it had gone to, right?
Right.
So what was it? Do you remember what it was saying?
Well, she could not. She put a trace on it,
Mm-hmm.
and that's when after that they told her that it finally left LA
Mm-hmm.
and went to France.
Right.
When it got in France, she got in touch with the post office when she finally knew what they were, and she asked. I think she asked them, "Are they going to come here to us in Ghana?"
Actually, they just volunteered that information. Yeah.
Right.
They told her. You remember they told her that it was that it probably went through customs.
Oh,
Right.
that's right.
You
Yeah.
forgot about that part.
Right. Yeah,
That it
customs.
probably when it went through customs, and if it's in customs, it's nothing they could do about it.
Yeah.
Right, it's nothing they could do about it. It was all up to customs, and so they said because it was medicine that she wasn't supposed to send just medicine. Any medicine coming from U.S. should go through the doctor. Right,
Right.
the doctor had to send it, but she sent it before, and it was never a problem.
Right.
So when they told her it was in France, they told her, well, they may send it. We can't tell if they're going to send it on to Accra, which is part of the capital of Ghana, or if they're going to send it back to you, back in LA.
Yeah.
Where did they send it?
They sent it back to LA.
They sent it back to LA, guys.
Yeah.
And so Joe was at the point where he was out of one of the meds. And so we started thinking, it was like, you know what? Yes, we thought about going to the doctor here and then I started thinking about, in some countries you could get prescription medicine, things that we need prescriptions for. You don't have to have prescriptions
Right.
here.
Yeah.
So we had a list of Joe's medicine, so we just went to the doctor and to the pharmacist, gave them a list, and what did they do?
They prescribed them. They checked and had all of them.
Had all of them, right?
Yes.
And were they expensive?
Oh man. Not at all.
They were. I think you had like
Yeah.
4 or 5 medications, which came under $20.
Right.
Right? 4 or
Yeah.
5 different kind of medication. One of them was mine, and then you had about 4, and came under $20, guys. So Who
Yeah.
knew?
Yeah. That was a relief.
Yeah,
Good, good relief.
because actually it was good. Why did it make you feel relief?
Because they have them. Exactly.
Mm-hmm.
Uh, so I don't have to, if I'm out of them, I know where
Right.
to go and get them.
Right. And then we don't have to depend on
Yeah.
getting it shipped here because I
Right.
think she had already. I'm pretty
Spend
sure
so
she
much
spent
money.
$100 and something to get it shipped here.
Yes.
And I did ask her where they're gonna give her money back, but however, so it was actually cheaper. It's cheaper for us to get our medications here,
Right.
right?
Yes.
Long as we know what kind it is. So that was the first experience, which
Yeah.
was a really
Very
pleasant
good.
experience,
Yeah.
right? Very pleasant experience. And so the second thing that happened, what happened was, I had like a little situation that came up in the middle of the night. And
Last weekend.
yeah, last weekend, and I kind of figured what it was, but we couldn't be for sure. And of course, I'm gonna Google it, and I was like, "Is this just like what could this be?" And Google said, "Get to the emergency room now."
Now.
Even if it's gone away, get to the emergency room. Like, don't get me wrong, y'all. I take my health, and we take our health very seriously. But it was a little episode that I had something I had just once when I was older, like a teenager, and so I remembered it right, and that's why I had another little something similar to it with my eye. Uh,
About 3 weeks.
about 3 weeks ago, right? And then I had it again, and so I was like, and so we talked. This was like in the middle of the night, baby. This was
Yeah.
like what time?
It was past 12 midnight.
Yes, it was past midnight, and I was like, okay, what would we do? I mean, this is good training for us. I mean, really, this is for any of us. It's like, Joseph, what would we do if this was a medical emergency? A true medical, Google said it was, but if it was a true medical emergency, what would we do?
Yeah.
Guys, we didn't know any doctors. Don't get me wrong, we had talked to several people several times that they had told us doctors' names.
But we didn't
We didn't write them down,
them.
right?
Yeah.
We didn't write it down, so we didn't remember. And two, they don't really have what you call a ambulance. Not just like it might be a number that you could dial, but even the neighbor who's Ghanaian didn't. She's like, you could dial.
You never
She didn't even know
know.
what the number was, right?
Yeah.
And then we've heard that they might come and they may not, and then we don't have a car, and we can't get a taxi driver that's gonna, that drive that late at night. It's not like a 24/7 system here.
Right.
They're trying to get more on that type of system, but it's not a 24-hour, 24/7 system here.
Right.
So we're like, okay, we need to take this seriously,
Yeah.
right?
Right.
So guys, so the very next day, it was like, okay, let me call the couple that we had spoken to before and ask them. They had been here 5 years. They're Americans. They've been here for 5 years. About list us about some doctors. So they gave us a doctor that they used that they were very pleased with. And then we also asked the neighbor, who's a Ghanaian, who's the owner, our landlord, about the different doctors. And so she gave us several lists. And she mentioned one hospital that was close, but we'd heard some not too good things about it. But oh yeah, they had told us about another hospital too. So we just wrote a list, like we would do at home. Babe, we had a list of doctors. The doctors, anything like that we would need in a case of emergency, and just if we wanted to go and have a physical, right?
Right.
So we just wrote those names down and have it on our refrigerator. Now, one thing, I'm gonna tell you what happened at the doctor's and what our experience was. Well, first of all, let me tell how was the kids' reaction. Like I was like, we need to talk to the kid, let the kids know, because we tried, like, if anything's not, it's like we weigh what we tell them. You know what I'm saying? Like, we don't want them to be concerned about something if it's not anything, but we don't want not to have told them something if it later end up being something. If y'all know what I mean, right? So, what was Twilla's? That's the oldest. What was her reaction?
Well, if are you going to come back here, go and see your doctors in U.S., or where we had asked her, we had told her that maybe we're thinking that we may go to doctors here.
Mm-hmm.
She said, okay, that sounds all right.
I don't think it
Okay.
sounds like that, Joseph. Oh, you
Well,
ain't.
no, but she was not like others who would
Like,
say, come on home.
no, no, she was. She didn't say it like that. She said, "Okay, you're right." She was like, "What are y'all gonna, y'all? So you gonna call the doctor, or y'all gonna find it out? Like question us, like like as parents would their young adult children."
Yeah.
She was like, "Cause I might need to talk to the committee." Now they call the committee our 5 children, right? So we can decide if y'all coming home. And she was talking one-way ticket. She wasn't talking about a round trip ticket. But anyway, but we did call a doctor, and we wanted to just we wanted to name the facilities because they, I guess even if they were bad, if our experience was bad, we'd still let you know. But
Yeah.
our experience was pretty good, right?
Yes.
Yeah.
Very, very good.
So the first doctor we got. Do you remember where we went first?
We went to Oak Tree Medical Center.
Yeah, Oak Tree Medical Center.
Cape Town.
Cape,
Cape Coast. I'm sorry.
Cape, that's right.
Yeah.
So this is one that Mikhail and no, the wife,
Kadisha.
Kazaya, her name is something like Kazaya. Yo, she has the prettiest name, and I butcher it every time. It's such a pretty name. Kazaya. It is so pretty. Anyway, so we called the doctor at Oak Tree Medical Center, and so they just told us we could just walk in. The doctor was there, and so we went there, and our experience was, we went in. We signed up. The receptionist was really professional, really good. They got us in really quick. The only thing that I had issue, it wasn't even an issue. I come from a medical background, so I'm used to working with doctors, right? In high stress situations, because I worked at Duke Medical Center and Chapel Hill University. Some in Charlotte. I worked at some, you know what I'm saying, emergency centers. And so I'm used to seeing the doctors like when they're not seeing the patients and them getting frustrated, or they've been like, or no, I don't want to say overwhelmed. It's just a lot was going on. And so he came out and he was talking to the nurse, and he was like, it had something to do with a film that someone was calling him about. And you could just see he was just kind of frustrated, not at the client, not at her or whatever. It's just like, and I was like, oh, is that the doctor? But yet, when they sat down, they got blood pressure, the temp, the pulse op, right? Weight. They did all that. They got us in the back, and the doctor was like, he got us in the back, and he was like, okay, what's going on? And I described my symptoms, and he's okay. He said, listen, I am a surgeon and a general practitioner.
Right.
And he said, what you're describing is something that, he said, I would not have the equipment here to do. So he said, just to be honest with you, he said, so I think you need to go to an ophthalmologist, is that what they call them?
Yeah.
And he said, I will give you the name of one, and we'll make sure that you get there okay. He said, but because we don't have the equipment, he said, I think you just need to go there. And he said, now with the things that basically what Google was telling us, the other symptom, because what the other thing could have been was a TIA, like having a stroke, a mini stroke, or a blockage, right? A clot in the back of my eye or something. And he said, those symptoms, he said, this is what those symptoms would be if it was that, and I don't see that in this. He said, so you need to go to the ophthalmologist. And two, I knew enough about strokes that I was like, I'm not having the droopy face. I'm not having, you know what I'm saying? I'm not having any of those symptoms. I did see why they would say that, but anyways.
We didn't give them what was the problem. What caused us to go to the doctor?
I just said my eye. It was optical migraine.
Okay.
Yeah, I was having, and I had it once before when I forget how old I was, but I had an optical migraine, and the thing of it is, it don't give you any pain when I had it then, and this time it didn't give me any pain. It's just that my vision, it was like looking through, like when I was a teenager, it was like all of a sudden this sight, the vision, I can't even remember which eye, is just like looking through this in out of one of my eyes, and all my peripheral was gone. And it lasted probably like, didn't last long, and then it went away. So 3 weeks ago I had something that's like, it was taken away, like my peripheral, and I was like, but it was very mild, like it wasn't anything like it was before. But this time I woke up in the middle of the night, and when I woke up, and even though it was dark, I was like, okay, I'm not seeing out of one of my eyes. And so I cut the light on, and again it was like, but this time, baby, I didn't tell you, it was like a little puzzle piece was taken out of my eye.
Oh.
It wasn't even like this, it was like a little puzzle piece was taken out, and it was like some flashy, but anyway, anyhow, I wasn't going to tell them all that, but since my husband said it, too much information.
No, that's
Okay. But anyway,
Might help somebody else.
it might help somebody. But anyway, so then we went to the they told our driver, the taxi, how to get to, told him where they were sending us to. So we got there, and when we got there, the she was so nice. And what was the name of that one? Do you remember the name of that one, baby? It was, I can't remember.
Yes, Salvin Medical Center.
Something like that. But it was good. It's not only just an eye doctor, but it's also they have an ear, nose, and throat in there. And I was like, that's good to know, because I've been having issues with my sinuses. But I digress. So she got in. Of course, she answered. She took my blood pressure again, asked questions, and then so they just did a battery, several, probably about 4 or 5 different tests on my eye, right? They put drops in my eye. They did the pressure. They did something where they took pictures of the eye. Took pictures of the eye, but then they did something else where they took pictures of both, where it showed the optic nerves and everything. I think the other one probably showed more the artery or something in it. And so she's like, your optic nerves are, is no occlusions or anything, is perfect. My vision is actually good. So she said if it was anything, it would be in this area. So I was just really pleased with them.
Yeah,
I was really pleased with them.
Yeah, they wrote out a good number of things, and that made me pleased.
Yes, it made me pleased too. And the thing,
good.
one of the things that we fall back on, this that it might be, and it's actually our next to the oldest daughter, Scholastica. She's the one that she had looked some stuff up, and one of the things that could cause it is dehydration. And y'all know I've been telling y'all how I sweat here in these Ghana streets, and I do have trouble like with dehydration. And I mean, sometimes I can think I've had enough water, and then if I go to the bathroom too much, or I'll go outside, and then it's like, okay, I need to drink more water. I know I need to probably be putting more electrolytes and minerals and stuff in my water, but yeah. So when my daughter told me that before I went to the doctor, I said, that's it. That's it. You know what I'm saying? I'm pretty sure dehydration is what caused it, because it was something else. It was some medicine, something that I took when I was a teenager that had caused it before. You know what I'm saying? It didn't just come on its own. But anyway, so so she said it could be dehydration. She said dehydration. What did she say? She said it could be medical issues like what do you call it? Diabetes, sickle cell. I don't have sickle cell, diabetes. I didn't do any blood tests to see. I mean, I hadn't been diabetic, but with diabetes, it's usually more blurred vision than this specific thing. What else did she say it could be? It was, and then she said dry eye. I just can't. Dehydration. So they gave me some lubrication drops and that. So that was it. But you know what? And I think that doctor's visit would have been under $20, because I think actually the drops cost about $20, right? Because I think in all it costs around maybe $40, right, for the whole thing. But the drops cost more than the visit.
Can you imagine that in U.S.?
So it was probably about $15 to $20 for y'all heard what I said they did for my eyes and stuff. So about $15 or $20.
Yes, it was good.
So our experience. So what did you think about the overall experience with everything? The pharmacy, the general practitioner, the ophthalmologist. What did you think?
No, I was very pleased. They were real professionals,
Mm-hmm.
and they did well.
Mm-hmm.
I don't have anything negative
Right.
to give about them.
Right.
So,
Yeah, I was really pleased too.
yeah.
Would you recommend any of them?
Yes, I
Mm-hmm.
will.
Yeah.
So maybe we leave their names.
Well, we told them the name
We
of
just said,
the
yeah,
facilities,
yeah,
so it's something that you
yeah,
can look up. Maybe I'll put it in the description too, because I know of people that their experience has not been that good here. So
right,
what I don't want to do is to to act like everything is hunky dory,
no,
because what we did go to people that would probably, like, asking somebody from the U.S. that had been here 5 years but would know probably the level of care that we're used to having, that have had some experience, because I think one somebody had some type of surgery on his back from the other doctor, right? And had a great experience with them. Um, Actually, the ophthalmologist was actually what that particular doctor. He's the one recommended her,
right,
and so our experience, it was just good. And so that is another thing I'm gonna say. Don't, because I've heard bad things about certain, like some of the teaching hospitals or something like that. Other people may have had great experience with it, right? But I don't want to. Hey, if somebody else done had the experience, I'll learn from somebody else's experience. I don't have to go through it myself. But an experience with it, and it was quick.
yes.
Oh, I failed to say that,
Yeah,
right?
it was in and out.
We were in and out of there in no time. So it was our experience. Like I said, it was just a good experience. And that's probably not everybody's case. And I do want to say too, we're part of a group, and one of the things that they're working on now is the wellness part, right?
Mm-hmm.
But one of the things they're working on is where people are making sure people, what is the word I'm trying to say? Check in,
Right,
right?
right.
Because it's been people that have come, don't have anyone, and then they
Yeah.
might find that person dead in their house or something
Yeah.
like that. So those are real situations. This group is, they actually had, I know one of the things they did, for one of the things we had to do is talk to, did this go out? One of the things that we had to do was to give them our names, and in that they would ask us, do you want us to get in touch with you? Do you have any medical histories? And then and then they had the people that's in charge of a follow up had to do a sign a confidentiality thing, right? So that you're not talking about somebody else's business. But what they'll do is do the wellness calls and stuff like that. So that is good.
It's good.
And so we are part of a group that has started that process anyway. But for us, it's like something that, it's something that I'm surprised that we didn't do that earlier.
Yeah.
Uh,
But this push us to do it.
Yeah, if y'all know our personalities, it's something that we would have done, because we brought several things here to make sure we was okay. Look, we brought a blood pressure cuff and got it here, and the stethoscope part was not in it, so that's not very helpful.
Yeah. Yeah.
But guys, yes. So y'all comment below and let us know, what have y'all's experience been, and if y'all have any questions about anything else, like with Ghana. And again, like we said, we're talking about everything medical today. If y'all have any questions about stuff, look, if we can help. As we just told you, we just started writing our list, right? And this is in Cape Coast. They will probably have a lot more facilities. I noticed even when we went to Kumasi had bigger hospitals. When we were in, you know what I'm saying? So you have hospitals and stuff around here. But if you don't know which hospital that is, and guys, even if we knew, but we don't have a way to get there,
Yeah.
you know?
And also know that if you don't have a car, if you have a midnight emergency, you may not be able to go anywhere. You may be able to go somewhere if you call somebody to come and take you, like cab.
Mm-hmm.
You need to pay them by cash.
Yes.
They don't take any kind of payments.
Right, unless you have a driver, they might
Right.
take Momo or something
Yeah,
like that.
right.
But if not, they're gonna want cash, and that's another thing. We just stopped having cash on us,
Yeah.
and stuff. So with so many things, we have to get better. We have to get better at, and we still have not. We still have not tackled that of what would we do in the middle of the night. You know what I'm saying?
Yeah.
Other than we need to get a car, or I even asked my husband. I said, "Would you have called the neighbors?" Would you? He was like, let me think. I said, baby, that's one thing I wouldn't have to think about.
Yeah.
They'd have been, they might have got upset with me, but you'd been at the hospital, and I don't even think they would have been. I think the way they look after you. You remember that time out there, he was wanting to check up on you to make sure that you're okay.
Right.
He had like 3 people. That he called. He tried to check up. Someone else told you that he had tried to check up and checked up, and then he called you again, right?
Yeah.
So yeah,
That's a trick.
yeah, because he wanted to make sure he was fine.
Yes,
so I think our neighbors, it wouldn't be any problem.
Yeah.
But we don't want to impose, and we still want to do everything else. Don't read us. Don't like if we need to impose, we will. But we just have to figure out what that is that we would do.
Something that we don't know yet is policies, insurance policies. Some may some may pay internationally.
Mm-hmm.
Some may not.
Yeah.
You-
She actually did talk about that.
Yeah.
Cause Kezia. It's pretty. But anyway, she did say that she checked into the international, like the different insurance that they have here, and she thought it was more expensive. One of them was more expensive. Now, they have a government one, but I don't think the payout is always the greatest. So a lot of times people may not use that, accept that. Is what I've heard. Now, I've heard there are some other good plans, but then, you're thinking like we're senior citizens. So, and just like it would be in the States, it probably a little bit more, right?
Oh, yeah.
Yeah, and so that is a thing, though. I forgot about that, Joseph. Someone did say that they were like they expect for you to pay for that bill before you leave, whatever it is. It might not be. I don't. You know what I'm saying? It may not be that much. It might be like but it could still be like $1,500 or something like that, like a surgery on your back, surgeries or something major. You know what I'm saying? Or 300. You and a doctor, and they're like, well, you can't leave. Who was that? I can't get it. Like, so you saying I can't leave until I pay it? They're like, right. They said, so what are you gonna do if I don't pay it? I have to stay here. And they said, yep. So I don't know how true that is. I can't even remember who I heard say that. It might have been on another YouTube channel or something. But yeah, that is a thing. So guys, I want to ask you, what would you do? What would y'all do? Do you all have plans if you're here? What are the plans that you have? Okay, I'm trying to get out the thing on the video. What plans do y'all have if y'all have any plans? What would y'all do if, in case of emergency? Do you all have your backup plan? That's even important in the States. No matter where you're, what country you're in, do you have a plan? If something happened,
Right. Yeah.
So, anyway, guys, that's what we wanted to share. Do you have anything else to say?
No, I think that's all. Just always try to Google if you need to.
When Google say, basically Google wanted to say, hang up now. You know how they say, if this is a medical emergency, hang up now and call 911. That's basically what Google was saying.
You don't have 911.
But that's what he was saying. I even asked, I said, so what would you do if I don't have emergency? You know what I'm saying? I know doctors or hospital around me or something I am, and it still just repeated it. It's like, you ain't getting me to, I'm not going to be liable, so I'm not going to give you the answer to that. But anyway, guys, so thank you for joining us as we continue to make Ghana home, which this is just another step in making Ghana home. Knowing what to do in a medical emergency, or just what to do if I need to go to the doctor. So again,
We say,
don't forget to
share,
like, what's up,
comment.
and subscribe, and we'll see y'all next time. Bye bye.